Welcome to Think Like a Nurse, the video outreach of Keith RN. Today's topic, my new workbooks, Rapid and Unfolding Reasoning. Workbooks that contain 12 clinical reasoning case studies to prepare you for professional practice. Most of you are now aware that the NCLEX just got harder in April of 2013 and passing rates have dropped significantly. In fact, before in 2012, 90% of all graduate nurses were passing the NCLEX. They raised the difficulty slightly in April of 2013, and now in the last quarter of 2013, they have dropped down to now 69%, a drop of almost 20% nationwide. Now, since the NCLEX assesses the ability of the graduate nurse to make a correct clinical judgment based on clinical reasoning, if clinical reasoning is deeply understood and applied to practice, the graduate nurse will be in a much better position to apply their knowledge to clinical scenarios that consist of every test question on the NCLEX and pass the very first time. Now, going back to our definition, what is clinical reasoning? According to Patricia Benner and the co-authors of Educating Nurses, it is defined as this. Clinical reasoning is the ability of the nurse to think in action, reason as a situation changes over time by capturing and understanding the significance of clinical trajectories or trends and to grasp the essence of the current clinical situation. Now, just as sterile technique and Foley catheterization required practice by you as the new nurse over and over to become proficient, it is my presupposition that thinking is also a skill that must and needs to be practiced. My unique clinical reasoning case studies make an excellent supplemental text to your education by allowing you as the student to practice nurse thinking with a concrete template of clinical reasoning questions that must be asked and then correctly answered for each clinical question. Now, the 12 studies in these workbooks situate and break down clinical reasoning as well as the following key NCLEX principles that will translate to clinical practice. So as we look at the NCLEX priorities and clinical reasoning, they're consistent. Number one, you must be able to apply that knowledge that you've been taught to the bedside. Number two, you as the new nurse for the NCLEX as well as practice must establish and recognize what is my priority based on the clinical scenario. Number three, you must be able to identify what clinical data in practice as well as on the NCLEX is relevant and needs to be recognized. And number four, you need to have a rationale and understand the why of everything you do in practice is important for practice as well as the NCLEX. For my workbooks, I've taken the 12 electronic PDF files that are currently on my website that are currently accessible and downloadable by anybody. I've taken and printed them up, and my first workbook that I've created is Rapid Reasoning. Now, these are basically the case studies include a blank question template. And let's just go to the very first case study here of post-op management day of surgery. As you can see, every question is open-ended. It's not multiple choice. The scenario is identified. You must recognize what data is relevant and then the clinical significance or the why of all that is done in practice. What this does is just it mirrors as closely as possible clinical realities. So these case studies, and all 12 of them, mirror as closely as possible my experiences as a current practicing nurse in ER and ICU. And the answer key for each one of these questions is a thorough narrative that is not a textbook. So for example, you can see everything in italics is referring to the answer. So essentially, you do the best you can, and my narrative will guide you to the correct answer to help you to understand and to deeply understand the most important concepts to clinical practice. This is 281 pages and is an intermediate level of clinical reasoning that is best suited for the first-year nursing student, but can be used by the advanced student or new nurse graduate as well. Many find this level just right because it is short, concise, and each case study can be completed in less than an hour. In addition to identifying what clinical data is relevant, I introduced my template of clinical reasoning. Again, 13 questions that situate your knowledge, that break down what does a nurse need to know as they look at a scenario and identify priorities as well as reason through that scenario. And therefore we also have the relevance. It is short and sweet, and it is again geared for the med-cert student. Unfolding reasoning is 377 pages and is an advanced synthesis level of clinical reasoning best suited for the second-year student. It has a higher level of complexity, and in addition to the higher level of complexity, it incorporates a change of status. Once the template of clinical reasoning questions are incorporated in the initial scenario, then the evaluation of nursing process takes place, and a change of status must be recognized and therefore identify the new priorities as well as the relevant data in that evaluative scenario that unfolds. Usually could be 2 hours or it could be 2 days. But it definitely requires the nurse, again, to clinically reason and to think in action. Now, though there is an endless amount of content that nursing students must master, as you know, our textbooks are our testimony to that reality. They're this thick, and there's like 3, 4, 5 of them. My case studies are just 12 because what I do is that I emphasize the most important concepts related to practice, and these 12 case studies situate the most important concepts so that once they are deeply understood, you're able to apply those concepts to a variety of situations that you will see in clinical practice. Now, student and faculty feedback to my clinical reasoning case studies found in my books have been overwhelmingly positive and validate their effectiveness. Rob Morris, a faculty at College of the Sequoias in California, says this: I've been using case studies for the past couple of years. The students love it, and our class time is much more productive. They score higher on the exams because of the application. And Monica Fliss, a former student of mine here in Minnesota, said this when I taught these the very first time as an early adopter of Patricia Benner's work: I love the way your clinical reasoning case studies were taught and structured. It made it much easier to remember and think critically about what we were learning. Now check out the link to my website for pricing and more information on bundling with both workbooks or my book, Think Like a Nurse, Practical Preparation for Professional Practice. This lays the foundation for deep understanding of clinical reasoning, that once this is understood well, you can apply it to the workbooks. Passing the NCLEX is good, but being prepared for professional practice is even better. And it is my hope and prayer that these workbooks could be an essential tool to make both of these essential objectives possible. Thank you.